Welcome back in. It's often called the silent killer, but there are things you could look out for before it's too late. Dr. Saudia Mushkbar is here with a family medicine physician from Toledo Clinic and is here so we can understand more about high blood pressure. Yeah, we all worry about high blood pressure and it comes as you get older. Let's go by the definition of what high blood pressure is, doctor.
Thank you so much for having me and giving me an opportunity to talk here. High blood pressure is something very common and very prevalent. 1 in 3 adults have high blood pressure. It goes by the numbers. We need to know the numbers. There are 2 numbers in the blood pressure. One is called systolic, which is recorded when the heart pumps, and it's the top number. The other number is called diastolic, the bottom number, which is recorded when the heart relaxes between the beats. So systolic and diastolic. And
are both numbers equally important, or is the higher number? Because you hear about you're trying to like, oh no, it's high again.
Both numbers are important because what we call that if there is one number which is high, we call it systolic hypertension. And if the bottom number is high, we call it diastolic blood pressure or diastolic hypertension. So the numbers are 120 and 80. So anything between 120 to 129 is considered elevated blood pressure. Anything 130 and above on the top number is called hypertension, which is the definition of high blood pressure. Anything above 80, which is the bottom number, is called hypertension.
Over the years, I know from, I looked it up because in the 70s and 80s, 140 was considered high blood pressure, and that has been moved now to over 120. Is it because they're finding better medicine practices are finding more impact on the body if your blood pressure is at 130 and 140 and 145 for a longer period of time?
Yes. Blood pressure is something which is a very modifiable risk factor. It affects every organ of the body. In fact, we call it a silent killer, as you started, because most people don't know what they are going through until the complications happen. Those complications include the effect of high blood pressure on their heart, their major vessels, their kidneys, brain, eyes. So modifying or keeping the blood pressure under control reduces those risk factors and those long-term damage to those organs.
And like, what if you're having the high blood pressure over a longer period of time? What can possibly be more likely to have a heart attack, a stroke? Talk about that a little bit.
Yeah. So like I said, that if blood pressure continues to run high, it is a strain on your heart. It is a very important risk factor to cause heart attack, heart damage, heart muscle damage. So that's where we need to prevent, to keep it under control to prevent a heart attack. Similarly, if it runs very high, it can cause lack of blood supply or stroke, which is either by hemorrhage or dead vessels, which can cause the damaged area in the brain, stroke in common terms.
Some of the reasons we could have high blood pressure could be heredity, it could be smoking, it could be poor eating habits, it could be weight, alcohol I saw was also a factor. Are those also equal in the cause?
So yes, those are the risk factors that can cause someone to have high blood pressure. There are other causative factors like genetic, and sometimes having underlying medical problem. For example, in extreme ages, we consider like somebody who's very young and healthy but have high blood pressure. It could be kidney problems which is causing that, or some other endocrine problems. As far as you mentioned about lifestyle modification, that not only causes you to have high blood pressure, it's also the first line of management. Like if you can modify those risk factors, healthy eating, low salt diet, exercise, limiting your alcohol intake, all that can help you in keeping blood pressure under control.
And the bottom line is we need to make sure we go to a medical professional to make sure we're well taken care of. So this is the doctor here. If you'd like to come and visit her with Toledo Clinic, she's at the North Point Professional Center. That's 4417 Holland, Sylvania Road. And there's the phone number if you'd like to know more about controlling blood pressure, even what it is. You should basically get that checked for sure. Doctor, thank you so much for being here today.
Thank you so much for having me. Thanks for your time.
We'll be right back.